Hello, welcome to Whiteboard Learning. This one is about inflammation, which if you've been around a long time, you know this is a talk I like to do occasionally, talk about how inflammation affects the body. The fun part about inflammation is it all started with the Greeks and Romans figuring out things like what happens to your body when it gets hurt. So here is your finger, and here's your other fingers, and your thumb. Very bad drawing, of course, if you know me. And then something happens to your finger. So let's say it's a bee sting, it's a trauma, it's a cut, it's a burn. Whatever it is, there's some bad thing. So some bad thing has happened to your finger in that spot. And what the Greeks and Romans in thousands of years ago realized is that there's some specific things that happen to the area that gets hurt. So that area here, what happens to it? Well, they notice that it turns red. They notice that it starts to swell. And they noticed that it is painful. And they also noticed that it was hot. And they also noticed it didn't work very well. And these were the cardinal signs of inflammation, the 5 cardinal signs. And in Latin, those are rubor, tumor, which you can get where tumor came, dolor, calor, like calorie, and this one's weird because this one got added later. It doesn't quite fit. Functio laesae, which means function is diminished. And so why would you do this? Well, this is all an evolutionary response. It would make sense. So what is red? That is the influx of blood to bring things to help heal the area. Swelling, well, there's too much blood, so the area gets swollen. Also, the cells will open up and release content, so it doesn't drain well. So cells are opening up and creating more fluid in the area, and blood vessels are leaky. And why is it painful? Well, you got lots of swelling, which means it's hard to move it, and then also evolutionarily, if it's painful, you'll rest it. That leads to rest. And an important point is why animals go and hide, is that they need to go rest the area that hurts. And so pain is a response to tell you don't use your finger anymore. And hot, well, increased blood flow, and some of the other agents that are called pyrogens, which help you get a fever, but they increase the temperature in that area, and so that can kill bacteria or viruses if they're trying to get through. And then again, back to rest. If the area doesn't work very well, you're less likely to use it. And so a non-functional area is usually due to all these things happening, and it's swollen and you can't use it very well. So those are the 5 cardinal signs of inflammation. And they make sense. And they're really important because it sort of points you out to thinking about certain things about the body. And this is a good response. Even though these things are all happening just in a small area, that's a good thing, and that area is going to heal. And then usually the healing is the product of all those cytokines that you hear about, and that's when it gets more complex, is when you actually study inflammation, and that's the interleukins and tumor necrosis factor and a bunch of other things. And a lot of these things are what anti-inflammatories work against when we're trying to decrease inflammation. So steroids and non-steroidals will all work against some of these different inflammatory mediators like prostaglandins, etc. So this inflammation is a good thing, and it's under kind of an exquisite control system of keep it in that area and don't let it leave. So sometimes around the area and in the area you have to have also anti-inflammatory mediators. And all of this is pretty good when it's in your finger. But the problem can happen when that doesn't stay in your finger. And that brings us to a little bit more complex scenario, which some of you have heard about, which is Systemic Inflammatory Response Syndrome. So SIRS, Systemic Inflammatory Response Syndrome, is when all of the things, all those chemicals that are here, spread to your whole body. And if they spread to your whole body, instead of being good for healing at this one spot, they can upset things that are further distant. So what are the things that it could affect? Well, it could affect your lungs. It could affect your heart. It could affect your kidneys. It could affect your blood vessels. What happens to blood vessels when they get inflamed? They get leaky. And then things sneak out of them. That's edema. They can also affect blood vessel strength. So if they're too dilated, they can't hold up your blood pressure. They also help activate your coagulation system. So your coagulation system can get affected. Your brain can get affected. Your hormones, like your adrenal hormones, can get affected. Your liver will stop doing things like making sugar and getting rid of toxins. So lots of different, I almost forgot one of my favorite ones, your gut. Your gut may slough, like dogs that get hemorrhagic diarrhea when they're sick with something else. So if it's local inflammation, that's good. When it's global, that's bad. And that's why some people end up on dialysis when they go in for something relatively simple. It's because their kidneys didn't do very well. Or when they get acute respiratory distress syndrome because they get problems in their lungs when they went in for something else. And so that's an important thing to think about, is these systemic responses, SIRS. SIRS, when it's really bad, can lead to another acronym, multiple organ dysfunction syndrome or multiple organ failure. And that's when these organs can't function anymore. So all these chemicals that were good in that tiny little spot, if they go crazy, they can get to the whole body. And that is when things can really get bad. So that's why a lot of times when we're screening people at triage, we're talking about assessing for things that might be part of this syndrome. So you can automatically see some of these is what's the pet's temperature. And if they're losing fluids because into the swelling and areas are getting dehydrated, and they get dehydrated because they're hot, their pulse might be up. If they have problems with their lungs, their rest rate might be up. And then the other thing we talk about in the SIRS criteria is white blood cell count. So certainly signs of a global problem, not just a local problem. And that helps us know how severe is this, local versus global. And so that's the way we kind of approach inflammation in the body, is trying to figure out if it's local or global, and how do we need to treat it, and how severe are the symptoms. And we're always watching for other problems in other areas.